Is Dr. Hummel Kothary, the Chief Medical Officer for Dignity Health Central California Division, and he has been joining us over the last several weeks talking about the coronavirus here in Kern County. Good morning, Dr. Kothary. Thanks so much for joining us.
Morning, Alex. Thanks for having me.
Let's talk a little bit about what we heard from the U.S. Surgeon General yesterday, which was he said that this is going to be the week. This is going to be our 9/11, our Pearl Harbor. And we knew this was coming. We knew this date was coming when we see cases start to peak. But as you are on the front lines of this pandemic, Dr. Kothary, what do you think about the message that this is going to be our 9/11 or our Pearl Harbor? Is that true based on your assessment of things?
You know, for most states, it is true. California, we're a week behind that, so we won't have that impact for another 2 weeks.
Okay, and let's talk a little bit about what other states are seeing right now, because the White House Task Force gave an update on the coronavirus yesterday and talked about this. There are several states in the U.S. that are seeing cases spike. And some of these states, I found interesting, were states that did not necessarily see a lot of cases up until recently, whereas California, for example, has seen cases for more than a month now. How does California compare to other states in fighting this virus?
You know, I think we're a bit more prepared since we are a large state. We've been watching New York and the Pacific Northwest, as well as Louisiana. We've been paying attention to what they've done, and we're mimicking a lot of that stuff. We're not, rebuilding that wheel all over again.
I want to show, we're looking at a graph here showing California's curve, and it shows that based on current projections, the state could peak on April 28th. Now, Dr. Kothary, that's several weeks away. Why is California's peak date so much farther down the road than the rest of the nation?
It's just the way the virus spread. It hit Pacific Northwest first, and then it made it up to New York. And then it's kind of moving west now. And it's skipping states in between, but it is moving west.
I want to show a graph that I made that I've been tracking over the last several weeks, and this shows our cases in Kern County. So the graph that you see on the right of your screen is confirmed total cases in Kern County. So obviously you can see that we are spiking. And Dr. Kothary, we've been talking about this exponential growth in cases. What does it look like for us in Kern County as we continue to see exponential growth in the county with new cases? How long do you think this is going to continue before we start to see the other side of the curve?
So our projected date to hit our peak is April 28th. Now, I don't know how true that is, but that's when all the smart people have projected that to be the peak. So up until then, we should keep seeing this rise. And then hopefully after that, maybe we'll start to flatten that curve.
This weekend, as I was, going to a restaurant to get drive-through food and going to the grocery store and so forth, as I was driving, I saw people still out and about not practicing social distancing. They were out at the park with a group of friends. I saw the golf courses were packed this weekend as well. What is your message to people who are still not understanding the importance of social distancing or may not understand that this is so crucial in the fight against coronavirus?
And that's what's really driving the peak. You know, the more we practice social distancing, the lesser that peak's going to be. You know, the sooner we'll flatten that curve. And I just can't emphasize how important this is. And I think, you watched on television, that's the message everyone's sending. Number one, social distance. So this is just something so important that we have to get this right, because that peak may even be higher.
We talked about masks last week and the CDC guidance that has kind of changed. There's been some mixed messages on the guidance of using masks. If you go to the grocery store, if you're going to a drive-through or curbside pickup, if you leave your house at all, should you wear a mask?
Not necessarily. The White House says anytime you go out, you have to wear a mask. I don't believe you have to wear a mask every single time. So if you are going to go to a drive-through, probably. The window that you're picking it up from 6 feet away, more than likely, no big deal, right? If you're going to go to a crowded grocery store, not a bad idea. But once again, it's the hygiene of the mask. You can't touch any part of the face. You can't rub up against it. You can't do any of that. You got to put it on and leave it on the whole time. And then when you get home, you take it off with the earlobes, and as soon as you take it off, you've got to launder it.
I was going to ask,
wash your hands.
Yeah, because
that's where the virus is.
Yeah, I was going to ask, for people who are making masks that you can reuse, they're not the N95 masks, but they do cover your face. How do you properly take care of that mask if you're going to reuse it? Do you simply, wash it with soap and water?
Right. Well, actually, in the washing machine, any kind of detergent will wash it and kill all the virus off. Now, I don't know if just soap and water in the sink is going to do much, potentially, but you have to really, scrub that mask. But yeah, just, general washing it. We tell people put everything in the laundry.
So just put it in the
and you got to do it daily. You can't reuse these masks over and over.
Right.
Because the detergents and soaps will kill it, and then you can use it again. Now, once again, when you put it on, you got to hold it by the little elastic bands, put it on your ears, and then, you wash your hands and you touch the mask to make sure it's all fit, secure, and then don't touch it again.
Let's talk a little bit about this treatment that we saw from the federal government yesterday, talking about possibly seeing medicine used to fight the coronavirus. Are we on the right track to possibly seeing medicine being used to treat this virus?
We are, in our hospitalized patients, we are using this medication. It's a combination of medications called Plaquenil and Zithromax. And it's the Z-Pack that everyone's always heard about. We're using these two in combination. However, these come at their own risks. It can cause arrhythmia. So you have to closely monitor these patients that are on it. We have to constantly monitor their EKGs because if you leave them even for a little bit, they can run into an arrhythmia, which is now a different problem you have to deal with, not just the coronavirus.
With us, again, we continue to test patients in Kern County. A lot of people, and there's still more than about 1,800 tests still pending. If people have not been tested yet and they have symptoms of coronavirus, should they immediately go get tested? Who should get tested and who should probably stay at home and self-isolate?
So if you have mild symptoms where you think, I think I can probably make it at home, stay at home. If you feel like, my fevers are high, I can't breathe, you've got other problems, you're just fatigued, you may have vomiting and diarrhea that can't stop, then go in. At that time, we'll test you, and if it's positive, we'll hospitalize you.
All right, Dr. Kothary.
A lot of our turnaround tests are still taking about 24 hours. So, a lot of times we send people home.
Right.
We'll say, hey, go home and self-quarantine.
All right, Dr. Kothary, thanks so much for joining us this morning, as you always do, over the past several weeks, and giving us an update on the coronavirus here in Kern County. And because, again, this is something that changes minute by minute, so we definitely appreciate you coming on and giving us an update.
My pleasure, Alex.